if we do a mistake in strategic implantology, of course, we have a failure. We have to admit this. We have to redo the case. It's a problem. It's not nice, but we can solve it. Now, the big difference, I would say, is that we can solve the problems. Second big difference is that we can treat everybody. I mean, there's no limitation from the bone. We don't have to select a patient. Patient selection, this is a very important point in two-stage implantology. They exclude all the patients which might be a problem. They end up in treating maybe 30-40% of the population. So what is this? 40%, 30%? What are the others doing? How are the others going to eat? There's no way. So this problem is solved by the strategic implantology because we can treat every patient that comes in the door of our clinic. This is a very big advantage. We use the cortical bone, this very safe bone, very stable bone, and we can rely on the stability of this bone. Another very big advantage. There's a lot of advantages. I can talk till the evening, Dr. Vivek. Well, in general, there was no peri-implantitis before, let's say, 1990, 92, 93. So this term, peri-implantitis, was not used. It was not known in our profession because at that time dental implants were polished. All the other implants which are used in the human body, like the fracture plates and so on, they are still polished. So obviously the traumatologist and orthopedic surgeon don't see any advantage in rough surfaces, but unfortunately this idea of the rough surfaces was brought into our profession in the 90s by companies like Straumann, Nobel Biocare and so on, because, I mean, you have to face it, this is a little piece of titanium, it's a little screw, and how you going to make a difference? It was a problem for the marketing department. They had to invent these surfaces, and then suddenly the implants were $350, and this was a big thing, and everybody very happy in these companies who are selling it. No, this is the point. There is no advantage of a rough surface, of course, for the patient. The patient only has disadvantage from it. The disadvantage is that as soon as the bone retracts a little bit and these rough surfaces get exposed, then patients get infection, and this infection is called peri-implantitis. And the big advantage of the simple dent line of implants, the BCs, the BCCX, and so on, zygomatic implants anyway, is that they are polished and that our patients are free from peri-implantitis. And this was shown in, recently this year actually, in two big studies which came out with totally more than 6,000 implants which were watched over many years. This was for our profession a very shocking result, because these two-stage companies, they all claim that even you cannot use polished implants because they are bad, they don't integrate, whatever they're telling, but it was not true. These implants are extremely successful and they are extremely safe for the patient. And that's the advantage of the simple dent line of implants.
Thank you, Professor Ihde, sir, that you have come all along the way from the Germany to participate. And yes, the good young people, and actually the people who are already doing the implant, they follow you and they have learned a new aspect, what actually was being spread the knowledge and what was the other aspect was there. Can you give us some advice actually, or so that they can follow the future, and what is the future of the implantology is going to be look like? So if your good words are there to give them advice so that they are going to build up their career.
Well, my advice is, of course, to skip the two-stage phase. I mean, not even to start with two-stage implants, because it's not necessary anymore. Right away go to single piece, go to immediate loading. There are going to be some cases which you cannot treat, of course, some single implants in some indications. So you find a good friend, and to this friend you can send those patients, they can spend the life with that. But you right away go to immediate loading, and you can go to treating a big lot of patients very successfully. You don't have to do the two-stage. You're so lucky that you are born late. You don't have to do the mistakes of the older ones. You just go right away to immediate loading.
Thank you, dentistchannel.online.